I've done FCR, I've done venetoclax, and I'm currently on acalabrutinib. At what stage would stem cell treatment be involved or be available?
So I just want to check, I heard you correctly. So you've had FCR and venetoclax, and you're currently on ibrutinib, is that right?
Yeah, I did FCR in 2013.
Yeah.
I did venetoclax, which was the 2-year process, 24 months. But I only got 9 months remission from that, and I started acalabrutinib 6 weeks ago.
Yeah, okay. And I think a very important thing to know at this point in time is whether you have or don't have a TP53 mutation or deletion, because that would definitely affect. I think if you did, then now would be the time to think about stem cell transplant. If you don't, then ibrutinib is likely to work for a significant period of time, and there are, as I've sort of outlined, there are definitely other treatments coming very soon. The decision to go through an allogeneic transplant or not is always a difficult one, because allogeneic stem cell transplants are hard work, for patients to get through. And there's lots of problems, infection problems, something called graft versus host disease, where the donor immune system can attack parts of your body, which can cause problems both in the short term and sometimes in the long term. But it is a very good treatment for CLL, and I think particularly at this stage, having had those treatments that you've had, being on ibrutinib, if you have a TP53 problem, that suggests the ibrutinib maybe won't work for much more than 12 to 18 months, and so now would be the time to think about an allogeneic transplant. But the good news is, if you don't have that, on average, in the study, you could hope to get 4 to 5 years out of ibrutinib, by which time it's likely there'll be something that's a bit easier than the stem cell transplant to have.
Peter, do you want to give us one from Zoom, please?
Thanks, John. It's a question about mRNA COVID vaccines. Is there any reason why someone with CLL would have significant side effects from these? The particular questioner says that they're fine with other vaccines, but when they have the mRNA COVID vaccine, they have a terrible reaction and are in bed for a week.
That's a very interesting question. I mean, I think the COVID vaccines are a different vaccine technology. There's not a specific reason that I'm aware of which people have understood why having CLL would make you more likely to have an adverse reaction, but certainly not just patients with CLL, but other people, even people that I know outside of work, have had significant reactions to some of the COVID vaccinations. I don't think we understand who gets them or why, but it's definitely a known problem. It would be interesting to study to see whether it is more common in people with CLL to have such a severe reaction, but they're sort of, the way that they work, it is different to how most older vaccines, for example the pneumococcal vaccine, work.
Nora?
Do we have a question here at the front? It's on.
Yes, it was just with regard to the very swollen spleen. Does that shrink back with the CLL treatments, or is it surgery to remove it or partial removal?
Yeah, the CLL treatments shrink the spleen usually back to a normal size again. And depending on which treatment you have, it will depend on how long it takes, but that's one of the things we use to measure, and that's part of having a complete response, is when you have a CT scan, there's no lymph glands that are bigger than 1.5 centimeters maximum length, and the spleen is back to a normal size.
There's a lot of talk about inflammation generally these days. Does this relate to CLL at all? Are we more inflamed than a regular population?
Well, that's a very interesting question as well. I mean, it depends on how you measure inflammation. In general, I would say actually no. Obviously, if you have an infection, there'll be systemic inflammation of some description. But actually, in many situations, treatments for people who have CLL and related blood disorders where the immune system is a bit suppressed, they tend to get less inflammation because they have less of an ability to respond. The immune system responds less than if you didn't have these conditions. So there doesn't seem to be an obvious increase in inflammation in CLL, no.